Today we are going to learn about the facial nerve, the seventh cranial nerve. In this session, we are dealing with introduction, embryology, nuclei of origin, course and relations of facial nerve, branches of facial nerve, blood supply of facial nerve, and applied anatomy of facial nerve. First, we are going to learn about the introduction of facial nerve. The facial nerve is seventh of 12 pairs of cranial nerves. It is a mixed nerve with motor and sensory functions. It emerges from the brainstem between the pons and the medulla oblongata, and it controls the muscles of facial expression. Its function to conveyance of taste sensation from the anterior two-third portion of tongue and oral cavity. It supplies preganglionic parasympathetic fibers to several head and neck ganglia. Next, the embryology of facial nerve. The facial nerve is developmentally derived from the hyoid arch. It is a second brachial arch. It arises as two main divisions, the motor and sensory. The motor division of the facial nerve, which is derived from the basal plate of the embryonic pons. The sensory division, which originates from the cranial neural crest. The nuclei of origin, the motor nucleus of the facial nerve. It lies in the lower part of pons. Superior salivatory nucleus. It lies in the pons lateral to the main motor nucleus of facial and give rise to secretomotor parasympathetic fibers that passes in greater superficial petrosal nerve and the coda tympani nerve. The nucleus solitarius. It lies in the medulla oblongata and receives the taste sensation from the anterior two-third portion of the tongue via the central process of cells of the geniculate ganglion of the facial nerve. General sensory afferent fibers through these fibers to acoustic meatus and back of the auricle through the communications of auricular branch of vagus nerve. And these fibers terminates in the main sensory nucleus and spinal nucleus of trigeminal nerve. Next, the course of facial nerve. The internal course. The motor fibers passes dorsally and medially, forming a loop around the abducens nerve nucleus in the floor of fourth ventricle, that forming the facial colliculus. The superficial origin at the pontomedullary angle above the inferior cerebellar peduncle. The facial nerve is formed by mainly of two parts. The facial nerve proper or the motor fibers, which arises from the facial motor nucleus, which is present in the pons. The nervus intermedius. It is the sensory root of facial nerve and it lies the position between the facial nerve proper and the vestibulocochlear nerve in the pontocerebellar angle, which carrying the parasympathetic fibers from the superior salivatory nucleus and the taste sensation to the solitary nucleus. Next, course and relations of facial nerve. There are two types of course and relation. They are intracranial course and extracranial course. First, we can discuss about the intracranial course or intrapetrosal course. The nerve that passes with the vestibulocochlear nerve to the internal auditory meatus. At the bottom of the meatus, the nerve enters the facial bony canal where it runs laterally above the vestibule of the inner ear, which reaching the medial wall of the middle ear, it bends sharply backwards above the pontomedullary or that forming the genu where the genicular ganglion which is found. It then arches backwards in the medial wall of the middle ear to reach the stylomastoid foramen, the extracranial course of facial nerve. It emerges from the stylomastoid foramen. It runs forwards in the substance of parotid gland and crosses the styloid process, the retromandibular vein and the external carotid artery. Then the facial nerve which divides behind the neck of mandible into its terminal branches, which comes out of the anteromedial surface of that gland. Next, the branches of facial nerve. The intracranial branches. The greater petrosal nerve, nerve to stapedius and coda tympani. Intratemporal nerves are intrameatal, labyrinthine, tympanic and mastoid nerve. The extracranial branches. The posterior auricular, digastric, stylohyoid. The terminal branches are the temporal, zygomatic, buccal, marginal mandibular and cervical branch. Next, anatomy of facial nerve. First, the nerve which gives a branch, it is called as nerve to stapedius, which supplies to the stapedius muscle, which give another branch which is called as greater superficial petrosal nerve, which arises from the genicular ganglion. The great superficial nerve which joins the deep petrosal nerve that forms the sympathetic plexus on the internal carotid artery, which is present in the carotid canal to form the nerve of pterygoid canal, which passes through the pterygoid canal to the pterygopalatine fossa and ends in the pterygopalatine ganglion. Next, the coda tympani nerve. The nerve which arises from the facial nerve which is 6 mm above from the stylomastoid foramen, and the nerve which runs upwards to perforate the posterior bony wall of the tympanic cavity. It then passes forwards on the medial surface of the tympanic membrane between its fibrous and mucous layers that crossing the handle of malleus. Then the nerve comes out the tympanic cavity through the petrotympanic fissure to the infratemporal fossa, where it joins with the lingual nerve. Through the lingual nerve, it supplies both the submandibular and sublingual salivary gland by the secretomotor fibers and the taste fibers from the anterior 2/3 portion of tongue. At the exit from the stylomastoid foramen, which gives a branch, the posterior auricular nerve, which supplies to the auricularis posterior and the occipital belly of occipitofrontalis muscle. Another branch which is called as digastric branch, which supplies to the posterior belly of digastric muscle. And one more branch which is called as stylohyoid branch, which supplies to the stylohyoid muscle. There are three nerves which arises from the exit of stylomastoid foramen. Finally, the terminal branches. The temporal branch of the facial nerve, or it is otherwise called as frontal branch of facial nerve, which crosses the zygomatic arch to the temporal region and which supplies the auricularis anterior and superior, and it joins with the zygomaticotemporal branch of the maxillary nerve and with the auriculotemporal branch of the mandibular nerve. The more anterior branches of it supplies the frontalis, the orbicularis oculi and the corrugator supercilii muscles. and which joins the supraorbital and the lacrimal branches of ophthalmic nerve. The temporal branch acts as the efferent limb of the corneal reflex. The second branch, which is called as the zygomatic branch of the facial nerve, or it is otherwise called as malar branches, which runs across the zygomatic bone to the lateral angle of orbit. Here they supplies the orbicularis oculi and joins with the filaments from the lacrimal nerve and to the zygomatico-facial branch of maxillary nerve. The third branch, which is called as the buccal branch of facial nerve, which is otherwise called as infraorbital branch of facial nerve, which is the larger size than the rest of the branches of facial nerve, which passes horizontally forward to be distributed below the orbit and around the mouth. The buccal branches of facial nerve, which supplies the risorius muscle, buccinator, levator labii superioris, levator labii superioris aliquot nasi, levator anguloris, nasalis, orbicularis oris muscle, depressor septae nasi, and the procerus muscles. The fourth branch of facial nerve, which is called as the marginal mandibular branch of facial nerve, which passes forwards beneath the platysma and depressor angulioris muscle. It supplies the muscles of lower lip and the chin, and which communicating with the mental branch of inferior alveolar nerve. The fifth branch of facial nerve, which is otherwise called as the cervical branch of facial nerve, which runs forwards, it forms a series of arches across the side of the neck over the suprahyoid region. One branch descends to joins the cervical cutaneous nerve to form the cervical plexus. Other supplies to the platysma muscle. Also supplies to the depressor angulioris muscle. Next, the blood supply of facial nerve. The facial nerve gets its blood supply from the four different vessels. First one, which is called as anterior inferior cerebellar artery at the cerebellopontine angle, which supplies to the facial nerve. Another branch, which is called as labyrinthine artery, which is a branch of anterior inferior cerebellar artery, which supplies within the internal acoustic meanders. The third branch, which is called as the superficial petrosal artery, which is the branch of the middle meningeal artery, which supplies at the geniculate ganglion region and nearby parts. And finally, the facial nerve, which is supplied by the stylomastoid artery, which is the branch of posterior auricular artery and which supplies to the mastoid segment. And the posterior auricular artery, which supplies the facial nerve at and distal to the stylomastoid foramen. The venous drainage, which is parallel to the arterial supply of facial nerve. Finally, some applied anatomy of facial nerve. The facial nerve lesion. When a lesion occurs at the supranuclear region, it causes the paralysis of lower part of the face and partial paralysis of upper part of the face, and normal taste and saliva secretion, and stapedius muscle which is not paralyzed. When a nuclear type lesion occurs, that may causes the paralysis of facial muscles at the same side, and paralysis of lateral rectus muscle and internal strabismus. When a peripheral lesion occurs at the internal acoustic meatus region, that may cause us the paralysis of secretomotor fibers, hyperacusis, loss of corneal reflex, taste fiber unaffected, facial expression and movement paralyzed. When an injury or lesion occurs at the distal to the geniculate ganglion region, that may cause us the complete motor paralysis at the same side, no hyperacusis, and loss of corneal reflex, taste fibers affected, facial expression and movements paralyzed, pronounced reactions of degenerations. Injury of facial nerve at the stylomastoid foramen region. In these conditions, which is known as the Bell's palsy. Some features of the Bell's palsy are unilateral involvement, inability to smile, close eyes or raise eyebrow, whistling impossible, dropping of corners of mouth, inability to close eyelids, inability to wrinkle forehead, loss of blinking reflex, slurred speech, mask-like appearance of face, loss or altered taste sensation. This is all about